Do you sometimes feel your heart racing, your throat closing, or your skin suddenly covered in red, itchy bumps after eating a certain food or getting a bug bite? If yes, you might be experiencing a severe allergy reaction called anaphylaxis. Imagine this: you eat a peanut butter sandwich, and within minutes your face swells, you start gasping for air, and you feel dizzy. That's not just a mild allergy, that's anaphylaxis, a life-threatening emergency. It's like your body sounds a massive alarm even though the threat, like a nut or bee sting, seems small. Without quick help, it can lead to shock or even death. But good news, if caught early, it can be treated fast. So what causes anaphylaxis? Think of your immune system as your body's security guard. In most cases, it protects you from real dangers like viruses. But in type 1 anaphylaxis, it makes a big mistake. It treats harmless things like peanuts, shellfish, or bee venom as dangerous invaders. Once you've been exposed to something like this, before your body might form wanted posters called IgE antibodies for that substance. The next time you meet it, your immune system panics and releases a flood of chemicals like histamine. This sudden flood causes anaphylaxis. Common triggers: peanuts, tree, nuts, shellfish, insect, stings, certain medicines like penicillin, and even latex. For example, if someone gets a bee sting and their throat swells, it's not the sting that's deadly, it's their overprotective immune system. Now, how do you know if someone is having anaphylaxis? Let's play detective. Imagine your friend eats ice cream and suddenly says, "I can't breathe." You see their lips swelling, and they break into hives. They feel dizzy and might even collapse. These are classic signs. Symptoms usually start within seconds to minutes, not hours. Other signs: itching, red skin, nausea, vomiting, weak pulse, confusion, or a sense of doom, like I'm going to die. It often affects more than one body system at once: skin, breathing, heart, and gut. So if someone has hives, skin and trouble breathing, lungs and low blood pressure, heart, think anaphylaxis. Quick action saves lives. How is it diagnosed? In an emergency, doctors don't wait, they act. They look at your symptoms and ask quick questions. What did you eat? Were you stung? Do you have allergies? But there's no time-consuming test during the attack. The key is fast treatment. The first-line treatment is epinephrine, also known as adrenaline, given with a simple auto-injector like an EpiPen. Imagine it as a reset button for your body. It opens airways, raises blood pressure, and stops swelling. You inject it into the outer thigh. Even if symptoms improve, you must go to the hospital because symptoms can come back. After the emergency, doctors may do blood or skin tests to confirm the cause. But remember, never use an antihistamine like Benadryl alone in severe cases. It's too slow. Epinephrine is the hero. Can we prevent anaphylaxis? Yes, it's all about knowing your enemy and staying one step ahead. If you're allergic to peanuts, always read food labels. Avoid foods which may contain nuts. Teach your child, your teacher, your chef, everyone about your allergy. Carry your EpiPen everywhere, in your bag, your car, your backpack. It's like a fire extinguisher. You hope to never need it, but you'll be glad it's there. Wear a medical ID bracelet that says allergic to shellfish or whatever applies. If you're allergic to insect stings, wear closed shoes outside and avoid sweet drinks outdoors. Also, make an action plan: what to do if you're stung or eat the wrong food. Share it with family and coworkers. Prevention turns fear into control. Scientists are working hard to make life safer for people at risk. One exciting advance is better bionic EpiPens, devices that can auto-detect anaphylaxis and inject medicine automatically, like a smartwatch that saves your life. Others are developing faster skin tests and blood tests to pinpoint allergies earlier. Researchers are also studying allergy vaccines, not to treat the attack, but to prevent the allergy itself. For example, giving tiny, controlled doses of peanut protein over time to train the immune system not to overreact. This is called oral immunotherapy, OIT. Some kids who once couldn't touch a peanut can now eat one safely, under doctor supervision. These advances don't mean you can stop carrying your EpiPen yet, but they offer real hope for the future.